Every night at 6 p.m., we are taking you deeper into the impact of the coronavirus. Tonight, I am joined by Dr. Richard Miers, the President and Science Director for HudsonAlpha Institute for Biotechnology. Thank you so much for being with us tonight.
Thank you for inviting me, Naja.
So what do you think about the governor's amendment to the Safer at Home order?
Well, I'm concerned. I think we need to continue to practice as much caution as we can. Of course, I care about the economy and people's lives and getting back to work, but we don't want to have a second wave. I think we should do everything we can to use masks as much as possible, to wash hands, monitor yourself as well. Unfortunately, well, maybe fortunately for this disease, not everybody gets symptoms, but that means you could be infectious without knowing it. But at least if you are having even vague symptoms and fever and any of the other symptoms that you hear about, stay at home and then figure this out. I think that we need the social distancing to be as active as possible. And really the best thing we're going to need, the most important thing that we need is to have a vaccine, have a treatment, and have much more testing than we're able to do now, and working hard on making that happen.
So in your opinion, is the timing right, or did Alabama do this too soon?
Well, I'm glad we hesitated compared to our neighboring states and some other states, because I think that will make a difference. It's hard to know, but we do know that it's still growing, and I think we need to take the advice of the CDC, the World Health Organization, our Alabama Health Director, giving us the best advice. Just as a scientist, we know how these things are being transmitted, and so more care, I think, is probably needed. I think doing things like picking up food on the curb and things like that from takeout has worked pretty well, and that actually, I think, helps to make it safe. I am worried about the real close contact stuff, and I think part of that depends on how the people who are operating the shops and the customers behave as well in terms of masks and distancing.
Yeah, certainly more important than ever as those close contact operations reopen, that we are mindful of those social distancing guidelines. Why is it, in your opinion, do you think that Huntsville has fared better than other parts of our state?
Yeah, that's a really good question, and I hope that remains, because we have been, I think some of that is luck. I think we have behaved pretty well in terms of moderately early on, not as early as we could have, started to practice some of the precautions that we have. I don't think it has anything to do with a special thing about our genetics or our population. Clearly, there are these hot and cold spots that are happening, and that could change in a day. So I think we shouldn't get cocky about it at all.
Good advice. What would you like to see, though, before the state totally reopens? Do you believe that there should be a vaccine first?
No, I don't think we can wait for a vaccine. That's possibly still a year off, although I will say that so many people worldwide are working on developing treatments which are different from vaccines, and vaccines that, and on as fast a way that they can possibly do, that, and we're hearing about the results from some of these at their early stages. So I think we will get a vaccine. We might even get it earlier than we had hoped, but not a lot earlier. I think the other thing that is needed is two other things that are needed. One of them is a treatment. We actually know that some drugs that have been under development for other reasons are showing some help here. You're not going to have one magic bullet. It's probably going to be a lot of different drugs. We at HudsonAlpha Institute, amongst many other groups around the country and around the world, are trying to work on an antibody-based treatment so that you give people antibodies that then neutralize the virus. I think those are going to work. They might work a lot faster in terms of the development of them, might come a lot faster than the vaccine would. That's not going to be all that we need, but it would be a major weapon in this arsenal that we need to fight SARS-CoV-2.
And can you tell us a little bit more about the work that HudsonAlpha is doing?
Sure. I think there are a lot of groups at HudsonAlpha. We're a nonprofit research and teaching institute. We do a lot of genetics and genomics, so we have a lot of the expertise that can be applied to this kind of a problem. But we also have 45 biotech companies that are tenants. We're their landlord. We work closely with them. And more than a dozen of them working with HudsonAlpha scientists are actually working on a variety of things. One of those is a treatment, so I'll mention something about this. This is the antibody-based treatment where you take blood from someone who has had the disease, preferably right when they've had it and then after they've recovered. And you look, and it doesn't need to be very much blood, but you look in the blood to see if you can find amongst the millions of different antibodies they're making, are they making some that will react with the COVID, with the SARS-CoV-2, the virus itself, and inactivate it. And so we've begun those studies actually even in late January, but then have stepped them up and sped them up and are doing a big collaboration with Huntsville Hospital, working with about a dozen patients to actually do this study. So far the results have looked positive. I don't want to say when it'll be ready because we don't know for sure that it's going to work. And fortunately, we're not the only people in the world working on this. There are many people trying to do it, and we're all sharing data very rapidly, very openly, and that's helping to make this happen a lot faster. So that's one of our big things at HudsonAlpha. The other thing that we're doing is working hard on doing testing for the virus itself, and I'd like to distinguish testing for the virus is when you are infected. It's where you do the nasal scrape or maybe throat or from saliva. That's looking possibly promising. And that's what's being used in the clinic now when people come in and they're sick or they've been exposed, and we do those, people do those tests. As you know, testing was slow to get started. We are in our building on 4 of our companies are working on testing. And some of them are being used. One of them does about 5,000 tests a day from around the state, but really around the country. That's actually a clinical test. The others are also working on figuring out how to do these in the field. And there's another reason for testing for the virus other than testing people who are sick. What if we could do millions of tests a day in the country? Then we could screen people and maybe screen, and they were inexpensive and rapid and accurate tests. That's critical. We could then be screening people even multiple times, once a week or once every few days. We're working hard on several approaches that could potentially do that. And that's now a screen as opposed to a clinical test. You're screening people who are not sick. You're screening every student who comes back onto campus. You're screening everyone in a company, even large companies. And so we're hoping that that will happen. As a scientist, I know the technologies do make sense, and I think we'll just have to work on the logistics and figure out how to make that happen as soon as we possibly can.
Well, the work you are doing is absolutely tremendous. Makes us so proud that it's happening here in Huntsville. We're going to take a quick break, and when we come back, we're going to further explore the search for a vaccine and discuss mutations of the virus.